Raise your hands if you can hear me. Right. Okay, very good. Sorry to keep you guys waiting. You know how I am about time. I got sabotaged a little bit today. But we are going to jump right in because we have a lot of things to go through. So you should be able to see my host screen now. Welcome to Full Circle's Practice and Pregnancy Orientation. I am your host, Dr. Adams. Many of you had your history visit today, so I just talked to you a little earlier, and then some of you will be having your histories coming up in the next couple of days, 2 weeks. So we have some housekeeping items we're going to go through. First, this is confidential. So um, no one else will know who's asking the questions. I will know because I get a report of who came to this later on, but you can ask anything you want. There are no silly questions. So please use the chat feature to ask me questions in real time. Please participate. I have some poll questions to make sure you're still paying attention and you're still awake out there. And then finally, if you have to jump off, I know it's dinner time coming up. The rest of this presentation will be available for you to watch on YouTube throughout the duration of your pregnancy. So we'll start out with a poll question. Who's on the line? So when you answer the poll questions, it also helps me know how to steer what's coming next in the talk. So how many first-time moms do I have on the line and how many veteran mommies do I have out there? And as this is kind of how it goes, I kind of budge for a little bit and then I say polls are closing in 3, 2, 1, and then we close the polls and we share the results. And right now, it looks like the first time mamas are edging out the mommy veterans a bit. And some people did not respond. Maybe we have some spouses or partners on the line, or people stepped away because they heard I was going to be 5 minutes late and not 3 minutes late. So maybe those numbers will go up as we continue. All right, so things we are going to go over today include the full circle experience, which includes where we deliver. We're going to go over some office protocols, talk about what to expect at your pregnancy visits. I'm going to give you a lot of prenatal resources. We'll go through a long talk about exercise and nutrition and pregnancy, and then wrap up with a COVID-19 update. So first, a little bit on the philosophy of the practice. We are a collaborative midwifery model, which begins with the premise that pregnancy and birth are normal life processes, not a disease process of which we must cure you. But it's normal. In the traditional midwifery model, they take care of normal low risk women, but if they identify certain abnormalities, then you need to transfer out from strictly midwife care to have access to physician care. In the collaborative model, though, you can stay in the care of the midwife. So you still get that midwifery care for your prenatal care and for your labor and delivery, but they have physician direction for any complications that occur with pregnancy. We meet every 2 weeks to go through the list of everyone who's pregnant and go through everybody's problems and make plans. So when you get plans from the midwives, the plans did not come from those midwives. The plans for any pregnancy complications came from the physicians. Um, to that end, though, most of the labors and deliveries are attended by the certified nurse midwives because that's really where they shine. That's their area of expertise, normal physiologic labor and delivery. If there are things that become outside of the scope of what's normal and physiologic, then they call us. And so urgent physician consults, urgent meaning it's not emergent, like you don't, it's not a got to get into the operating room right now, but my baby's not coming out, it's misbehaving. They call one of us, one of the full circle physicians, sorry, is always backing up the midwives. And so we're happy to come in. We all live about 15 minutes from the hospital and we can get there. If you don't have 15 minutes though, OB hospitalists, board certified obstetrician gynecologists are in-house 24 hours a day for true emergencies. And to put that in perspective, that is less than 1/3% of our deliveries. You can see in there in 2023, they were called 547 times. And not mostly their emergencies are where even the midwife isn't there, and you come in 10 centimeters and somebody has to catch the baby. Not usually true emergencies. So where we deliver now, we are at HCA Florida, which is formerly known as Memorial Hospital over on University Boulevard. It's less than 10 minutes from our office. They are doing tours. They do regular organized tours, the Stork tour, they call it quarterly. They just had one in May, so I think the next one is in August. In our exam rooms, we have little bulletins up that have the dates of them and a phone number to register for it. If that's too far out, or you don't think you'll remember because pregnancy brain, they do one-to-one tours, or if even the time doesn't work for you, they do them during the weekday, they do them in the evenings, they do them on the weekends, whatever's convenient for you and your family to be able to come and see their remodeled unit. It is quite lovely. And it's been a really good move. We've been over there since October of last year, and it's been nothing but fantastic. Patients really are enjoying their experiences. Our office is open Monday through Thursday from 9 a.m. to 1 p.m. We close from 1 to 2 for lunch, and then we reopen at 2 and we close at 5. So if you call between 1 and 2, you will get the after hours voicemail. There's a reason that we do that. It's so that it rolls to the emergency on-call provider. So if you're having a medical emergency between 1 and 2, you will get the on-call provider. That message is not for you to say, I'm going to be late for my 2 o'clock appointment, because she does not relay that to the front desk. She's not going to refill prescriptions between 1 and 2, none of those things. If you have something administrative, please call back after 2 to get the front desk staff by pressing 0. Otherwise, but if it's an emergency, please leave a message for the on-call provider. On Friday, we're open from 9 a.m. to 1 p.m. So if you're calling with something administrative at 12:50 on a Friday, just know that we may be responding to that on Monday, if it's not a holiday, or Tuesday when we reopen for business. We do not have walk-in appointments because our goal at Full Circle is to see you as close to your appointment time as possible. And we cannot do that if we promise you the 2:20 spot and someone else decides they have an emergency at 2:15 and they run in and cut you off. We promised you that time, so that is your time. We will not give it to someone who walks in. So we ask that you respect everyone else who's made appointments as well. To that end, we also have limited same day appointments. And I will be honest with you, it is the summer and there are a lot of staff vacations during this time. So limited same day appointments is with an exclamation point this month and next month. It does get better in the fall. And I'll be honest again, it does go back to the same thing around November and December. So twice a year, there are very limited same day appointments, but usually if someone delivers, things clear up, we're able to scoot you in someplace. If you are calling, say at 10 a.m. and saying, hey, I have a problem, I really need to be seen today, and there are no same day appointments, we might recommend you either go to the hospital or be seen at urgent care. That's not us saying we don't want to see you, we don't want to take care of you. It's us saying we agree with you. This is an urgent matter, and we don't think you should be sitting in our lobby waiting to get worked in if somebody doesn't show up. So Tony says, go to the hospital, please. Please go to the hospital. Providers are not able to leave patient appointments to take phone calls because, once again, I promised you this time. And so this is your time. I'm not going to leave your appointment to go answer someone else's question. But we do have Tony, who is our nurse who takes patient phone calls and she responds to them. We typically have a lot of the same questions come through. And so Tony's familiar with how to answer them. If there is something out of her scope, she knows how to reach the person on call to be able to get you those answers. If you are calling, please leave a message in order to receive a call back. Sometimes people call and hang up and call and hang up and call and hang up. We won't know that it was you unless you leave a message, and please leave the message with the appropriate person to make sure that you get your response in a timely fashion. So the appropriate people are as follows. If you have pregnancy administrative things like letters or forms, such as disability or FMLA, Tony is your point of contact. We are going to be moving away from doing maternity FMLA paperwork in the office and using a third party to get it to you faster. Currently, most offices have a turnaround time of about 10 business days for FMLA paperwork. We have a vendor now who is able to get it to you in a day or two, which is much better for you and better for us. The OB clinical coordinator, many of you have already had interactions with Naisha. She's sent your labs out to you. She's also the person who handles referrals, like if you need to see a high-risk doctor, cardiologist, if you need to have additional blood work done or have your delivery or version or what have you scheduled. She's the one who does that. She also schedules circumcisions. Everyone on this call has probably met with Renee Hall if you had any financial responsibility, because she's our benefits coordinator. So if anything changes about your insurance, I know some of you are going to be delivering in January. So if your insurance changes, please, please, please let Renee know as soon as possible. Some of you have insurances that end before the end of the year. Let us know about any of that as well so that there are no surprises in terms of patient responsibility. Or if you think you went to the hospital and you already met your deductible and you shouldn't be paying us anymore, please let us know that too, because we don't want to over collect on you. After hours, there is always someone from our practice on call for our practice. This person is there for emergencies. So think this is if you need to go to the hospital. It's again not for prescription refills or appointment concerns. You must leave a voicemail for them to even know that the call came through, or else it won't register on the call. So please follow the prompts and follow the directions to let her know that you are calling and you are headed to the hospital or you think you need to go to the hospital. Other ways to contact us include the patient portal. Please remember the portal has response times that can take up to 2 business days. So when you send a message, a little notification pops up that says, please allow 48 hours. It's really 2 business days for us to respond. So if you're sending a message on a Thursday, you might not get a response until Monday. So please remember that portal messages are not for emergencies. You're seeing the next slide. If it's a non-action item, like you're writing a message about supplements that you can take or that sort of thing, we might ask you to hold on to that until you come to your next appointment. And then finally, a good use for the portal is losing your lab slip. So if it's something that you need to do before your next appointment and you want us to send you another copy of your lab slip, that's a great use of it. Or if your next appointment is more than 2 business days away, and for example, you are sick and you need to cancel your appointment or convert it to a virtual visit, then you can send a message. If it's appointment requests, you send it to them. If it's a clinical matter, please select clinical matters and it will go to one of the providers. Things we do not want to see on the portal. Please don't send urgent matters. When people send messages like, my blood pressure has been really high and I have a terrible headache and I can't see out of my left eye, please don't put that on the portal, because if it sits there for 2 business days, that's not good. If you're not feeling your baby move, if you're having heavy bleeding, those are emergencies. Those are things we want you to call the on-call provider for. So please take advantage of that. It's calling the regular phone number and following the prompts to get to the on-call person. Please don't send blitz messages. So sending multiple messages, like cutting and pasting and sending it to each of the midwives. I don't know who's on call, so I'm going to send it to all 7 or 8 providers. Please don't do that. People get very upset when they come back and realize they have 8 prescriptions at the pharmacy, and it's because they sent a message to 8 different people. The portal will also sometimes think that you are a bot spamming the system and will delete your account. It's really hard to get it reinstated with the email that we have on file. So please just send one message. If you have not heard from that person in 2 business days, then you can send it to somebody else. And then finally, please don't attempt to have an appointment via the portal. Sometimes people will say, hey, I found this article. I want to know what your thoughts are about this or that in pregnancy. That's a visit. We do visits during regular business hours. And so we're happy to have you schedule an appointment to see us for that. Or if it's something you want to have a conversation about, text yourself the question to remind yourself to ask about it at your next appointment, because we do see you a lot. And we're happy to have those conversations in person versus going back with short answers and forth on the portal. Sometimes tone doesn't translate over the portal too, and I'll say something and someone comes back and I'm like, no, what I meant was this. And now we're like 7 messages in and I haven't gotten to spend time with my family, which is what I'm really supposed to be doing in the evening instead of portal messages. We do release ultrasound reports over the patient portal. Unless it is something urgent, if there's something urgently abnormal noted, we will not let you leave the office without making a plan for what comes next. That is the one time that we will interrupt our schedule, our day schedule, and one of us will come in and have a conversation with you. Otherwise, we have to wait for the sonographer to generate her report, download it from her machine, upload it into our electronic medical record system, divide it among the providers, and then we review it. So please give us 2 business days to receive your report, review it, and respond. Now, if you know that your anxiety is not going to let you wait 2 business days to know what's on the report, please make an appointment on the same day after your ultrasound so that she can get a preliminary printout. Your midwife can get a preliminary printout and go over what the salient points are for you for your ultrasounds. Other people with portals, Quest. Quest has a portal, and sometimes Quest will put your results in their portal before they send them to us. Then you see the results and you see, oh my gosh, everything is red, and it freaks you out. So, first thing, red does not necessarily mean that it is abnormal. The reference ranges that they use to determine whether it's a black result or a red result are different. They're using non pregnant individuals, and some things that are not okay outside of pregnancy are actually physiologic changes and okay for pregnancy. So give us a chance to receive the labs from Quest, review them, and release them to you. Now, if you've had the labs for over a week, there's a possibility Quest didn't send it to us at all. Just let us know, and then we can request it from Quest so we can get it. Please don't upload your Quest labs into the portal because it does mess up our loop of how we ordered it and how the loop gets closed. Computers. All right. Any questions on how to contact us, what our hours are, how to reach us, who to talk to for what? Cool. Let's move on. What to expect at your prenatal visits. One, expect that you are going to forget all of the questions that you had before you walk in the door. I don't know what it is. I think maybe it's hearing the baby's heartbeat. You just kind of forget everything else. So please start a text thread with yourself. Text yourself questions so that you can ask us questions and have good conversations, good meaningful conversations during your visit. Wear loose, comfortable clothing so that we can access your belly. I think rompers are almost out of style now, thank goodness, because that was like the worst trend for prenatal visits because we could not get to your belly without you getting half naked in the visit. So a shirt that you can lift or pants that you can scoot below your belly, just something so that we can get our hands on the belly to listen to baby's heartbeat at every visit. We ask that you arrive a minimum of 5 minutes before your scheduled appointment time so you'll have time to check in and deal with any insurance things with the front desk. We are not routinely checking urine samples because ACOG, the American College of Obstetricians and Gynecologists, says that's no longer necessary. Only people we're checking them on routinely is if we're following you for elevated blood pressures and we're looking for protein, or elevated blood sugars and we're looking for glucose. Or if you just had a urinary tract infection and we need to check a test of cure. Front desk will typically know if you need to leave a urine sample, but if you know you don't, go to the bathroom. We know you're pregnant, you've been drinking your water all day, you better be drinking your water, especially in the summer, drink your water. And we know you have to go to the bathroom, so please go ahead and do that. Um, if you are 10 minutes late, we will have time to check on you and your baby, but that obviously leaves a little less time for your questions. If you're 20 minutes late, you've missed your entire appointment slot. And if there is an opening later in the day, front desk is usually pretty good about, oh, she's not going to make it for this 4:10. Let me scoot her over here to the 4:30. We may be able to work you in a little later in the day, or we can reschedule it to a time that is mutually appropriate for everybody. All right. Diagnostic ultrasound visits. So, question we get is, when will I have my next ultrasound? That first one was so much fun. It was, wasn't it? Diagnostic ultrasound appointments are separate from prenatal visits. And so the way to know that you have one scheduled, everyone typically has one right around 20 to 22 weeks. But some people need more. If you're having twins, if you have a short cervix risk, that sort of thing. The way to know if you have one coming up is to look and see if you have more than one appointment time. Is there a provider's name associated with your visit? So Tina Test is my fake patient. Tina logs into her portal and she clicks on appointments and she realizes that she has 2 appointments on one day. Her first appointment is with ultrasound, and so Tina will know that she has not, it's not a provider's name, so Tina has an ultrasound. And then her next appointment is with Dr. Yeckel. So Dr. Yeckel is a provider's name. So Tina knows that she has an appointment with ultrasound. She's getting an ultrasound so she can tell her family, hey, come be with me at 9:20 so you can see the baby. And then at 10 o'clock, if you want to be there, Dr. Yeckel will be able to go over the preliminary results of the report. So please let our staff know when you're scheduled for a diagnostic ultrasound. We try to tell you during your visit, hey, it's time for you to schedule another one. The sonographers also tell you, I didn't see everything today. We need to look again in 4 weeks or so. And so just let the front desk know if you're supposed to be scheduling your diagnostic ultrasound and your return OB. Remember, we will not let you out of the building, though, if there is something abnormal about your ultrasound that needs to be discussed so that we can make a plan. Otherwise, we do send the results to your portal within 2 business days. Okay. Now, if you want to look at your baby more than we need to look at your baby, there are boutique ultrasounds around, and boutique ultrasounds, these are just a couple for informational purposes. We're not endorsing any one over the other, but just these are a few in different areas of the city. And they do cute little things like 3D ultrasounds and putting baby's heartbeat in a stuffed animal. It's really adorable. You can bring your family and all that good stuff. And they are just ultrasounds. There's no radiation, and so you can do them as often as you want to. So we have a portal. No, we have a poll question, not portal. See, y'all know, you can tell I've been on the portal all day. When should I expect routine ultrasounds? So, will you get an ultrasound at every visit? Will you get them at 20 weeks, 40 weeks, and 41 plus? Or do you only get ultrasounds if you have a problem? And our polls are closing in 3, 2, 1, and we're closed. 20, 40, and 41 plus. So the key word here is routine. So routinely, we will look at baby at 20 weeks for anatomy. If for some reason we don't see everything and you need to get another ultrasound, then we'll schedule that as well, but that is not routine. But if you go past your due date, routinely we will look again to make sure that the fluid is still good, baby's movements are still good, and it's still safe to stay pregnant. All right. Good job. You guys are listening. We are going to scoot over, I believe, now to our website. Yes, this is fullcirclejacks.com. And at the top here, you'll see a banner that has a blue here. You can click there to watch the town hall that I held back in October with our patients regarding our move to HCA Florida. We should probably do an update on it and just tell people how good it's been, because I believe we've done over 400 deliveries there now. So we need to update that it's been amazing. But if anybody had a baby with us before and you're wondering why we moved, please watch the town hall and you'll see. Let's move down to the providers. So we're going to click on this array of lovely ladies, one of whom will have the honor of helping to deliver your little one or little ones. All right, so we have me, and we have my partner, Dr. Mero. We have Dr. Yeckel, and we have Dr. Mooney. And then we have the midwives. There's midwife Lauren, there's midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And every single person on this page, this is absolutely our favorite thing to do. And so any one of us will be absolutely thrilled. Don't worry if you don't, like, we never know which one of us is going to be on call. So try to meet as many of us as possible. It may be a bit harder to get in with the physicians because we're usually doing more GYN. The midwives are manning the OB portion, the pregnancy portion of the practice. But you'll form a rapport with any one of them in labor because, again, like I said, we are certified birth geeks. All right. Also at the top here, you will see patient information, and you're going to click on the obstetrics tab, and you'll know you're in the right spot because you'll see all the bellies there and ending with the baby there at the end. Lots of good information here, starting with our delivery stats back to 2018. And this is just some good information on our VBAC success rates, our NTSV, which is a new measure being tracked by the Joint Commission Hospital organization of how many first-time moms end up going to cesarean delivery, and just tracking our numbers because we're very transparent. Some years are better than others, and so if we don't look at our numbers, we can't see how we can improve for you. So good information out there to look at in your spare time. The box we will click on is our prenatal care timeline. So when you open this up, you will see things that should happen and when. So everyone on here has had a pregnancy confirmation visit. And at that time, you go over you talk to Renee Hall, review your insurance and prepayment plan. You have your ultrasound, and you saw a little video of me with my hair done, talking about joining me for this call and what's coming up next. Then you will have a history visit with me if you haven't already. It's a virtual visit. It's not on Zoom, but it's on Doxy. And so the morning of the visit, you do get a portal message telling you how to log on and have that visit with me. And on that visit, we talk about your medical history and determine whether any baseline labs need to be ordered. If you don't have anything out of the ordinary, our standard prenatal labs are right there in that first box. We do have lab transparency here. So you will see what labs we order and when. and what things are optional. So that next box is optional, and it's genetic screening. And we discussed during your history visit what the options are for genetic testing, and you can opt in or opt out. It's probably 50-50 about who actually does. At this point in pregnancy, we are seeing you every 4 weeks in the office. So when you called and said, "Hey, I'm pregnant," they were like, "Great, I'm going to schedule you for 3 visits." And it sounded overwhelming. Don't worry, we are not stalkers. But your next visit is your OB physical, and that's typically within about a week or two after you see me for your history visit. And your physical is just like it sounds, a regular physical exam: heart, lungs, breast exam, pelvic exam. If you are due for a PAP, you're welcome to have one done during that time, but it's not part of the routine panel, so we don't require a PAP at that time. We do need cervical cultures, though, as part of the ACOG panel for pregnancy. And that can be a self swab if you're trying to avoid a speculum exam. Those who have high risk issues and need referral to the high risk doctors, typically we'll talk about that during the history with me, and they usually will see you right around the end of your first trimester, unless there's some reason they need to see you sooner. 4 weeks later, you're back in the office and we're doing your second trimester check, talking about what things routinely happen during second trimester. And then right around 20 weeks, as we discussed, is your anatomy ultrasound. You'll see there in the middle the mental health screen. This is routine. So we like to get a baseline. Pregnancy is full of emotional ups and downs. And so we like to get ahead of pregnancy anxiety, pregnancy depression, and get baseline screens. So regardless of what your history reveals with me, everybody gets this screen, so we know how to best take care of the whole person. If you're doing your anatomy ultrasound and need to meet with a midwife, she will typically at that time not only go over your results, but start talking about childbirth education and or breastfeeding classes. Then about 4 weeks later is when we move into the time when we typically order our glucose tolerance tests. And we're going to put a pin in that because I do have a conversation about glucose to come up later on. So if you have questions about glucose, please hold on to those for a moment. My moms who are Rh negative, we have a couple of different conversations going now. We're not necessarily giving RhoGAM if you've had another blood test that can test baby's blood type to see whether or not you actually need to get RhoGAM, because there's a national shortage right now. And if we don't need to give it to you, we would prefer not to. This is when we have you pre-register at the hospital. You want to be looking for when the tour is going to be for you. And if you plan to work with a doula, you want to have her secured by this time as well. We'll talk more about what doulas do and why we recommend them in a moment as well. Then we scroll down and we start seeing you every 2 weeks. So this is when it begins to ramp up. You'll see there in the middle the option to repeat or decline the standard prenatal labs. So ACOG recommends doing them one time. Duval County Health Department, which as you can imagine covers many different stratifications of risk in this county, recommend doing it twice for higher risk populations. If you feel you're not in a higher risk group, we do have a form to just very easily opt out of repeating them. My first time moms, you want to start looking for who your pediatrician is going to be, because as much as I love your baby, once he or she or they are out, they need somebody else to take care of them. So my veteran moms, you want to make sure you're going to stay with the same pediatrician or select a new one. Many of them do have meet and greets, and we have information and contacts for many of them here in the office, brochures and cards you can get. Tdap vaccine, RSV, depending on the time of the year. They're not offering RSV right now, so it's very difficult to get it. We've not been able to find a pharmacy that is carrying it now, and or flu shots if it's between October and March. We don't give any of those here in the office. You would typically go to a Minute Clinic or your primary care doctor for that. So we start the every 2 week visits, and moms who have certain pregnancy complications like high blood pressure or diabetes will begin your fetal testing. And then we continue with every 2 week visits until about 36 weeks. For my moms who know they're going to have a cesarean or a belly birth, as we term it here at Full Circle, we try to get your dates scheduled when you're about 33 weeks for your 39th week so that you can start planning and having family come in town and all that sort of stuff. At 36 weeks, we do another pelvic exam where we screen for group beta strep, and we'll explain what that is and why it's important at that point. And at that time, you have the option to repeat. If you've already opted out of repeating your prenatal panel, then you've opted out of repeating STI screening and cervical cultures as well. This is when we start seeing you weekly. So you're going to be full term at 37 weeks. Yay. So you can bring in that birth plan because all things are back on the table once you are full term. We start your natural cervical ripening methods. My mama's having a belly birth. We're going to get off the train around 39 weeks, unless there is some other reason, like you're having. If there's a placenta previa or previous fibroid surgery, it's usually closer to 37 or 38. My moms who are waiting to go into labor then need to be patient, be patient, be patient. And we like everybody evicted by 42 weeks. So 41 weeks and 5 days for first time moms, 41 weeks and 6 days for second time moms because your labor tends to be a lot faster. So we're going to head back to the presentation as I set the expectation for first-time moms that your first labor is usually around 24 hours. So just go into it with the mentality of 24 hours on average. Some people go a little bit longer, some people go a little shorter, but just expect about a day. All right, I have a poll question. If you have a headache during pregnancy, are you more likely to meditate? Are you more likely to take a Tylenol? Or are you more likely to go to the emergency room to evacuate? Meditate, medicate, evacuate. All right, polls are closing in 3, 2, 1. Taking a Tylenol. Okay, okay, y'all, listen, any given day, you can ask my husband. Sometimes I'm meditating, but most days I'm medicating. This is our list of pregnancy safe medications. So here you will find a list of common pregnancy discomforts, and they are in alphabetical order. So in the middle, you'll find relief measures. So if you send me a portal message saying, "Oh, Dr. Adams, I'm so constipated," the first thing I'm going to ask is, "Have you tried everything on our website?" And and it's not just me. All the midwives are going to do the same thing too. So y'all, some of y'all have gotten slick, and the first thing you say is, "Hey, Dr. Adams, I've tried everything on the website already. I'm still having this problem." So if that is actually the case, then definitely reach out to us because it may be time for either prescription medication or some other tests that we need to run. Make sure you're actually having just the simple problem on here. But these are all common discomforts, common symptoms, and you can scroll down to the next page. You can see there's some things on here that we don't recommend. There are some caveats, especially regarding nausea and vomiting. Typically, nausea vomiting gets better after 10 weeks. If you start noticing it getting worse after 10 weeks, it could be a gastroenteritis. And so these things still apply to help with the nausea. But again, if it's not working, please reach out to us if you're not able to keep down fluids for 24 hours. So you can just take a look at all of these things. If you're old school like me, you'd print it out and put it on the fridge, but you can download it to your phone because I promise the time you always need these things is like 3 o'clock in the morning. And this can save you a lot of heartache and Googling. The next box on here is our gestational diabetes screening test. We're not going to click on this box, but please remember that it's out here. I'm going to refer to it in a moment when we talk about gestational diabetes screening. The weight gain in pregnancy box is next. We're going to click on that because some of you are very concerned that you haven't gained any weight. Some of you are very concerned that you have lost weight. Some of you are concerned that you've gained too much weight. You can see the recommended pregnancy weight gain based on what your pre-pregnancy weight was. So there's a link on here at the bottom of the page you can click on to put in your height and weight, and it'll give you your pre-pregnancy body mass index. Based on what that number is, you'll see what the recommended weight gain in pregnancy is. And then over here in that last column, what I want you to take note of is that the rates of weight gain are in your second and third trimester per week. First trimester is just survival mode. Do what you can. Babies crave carbs, you have food aversions, you're nauseous, all the things we understand. We measure how much weight you gain by what happens at 13 weeks on. So these are your goals to achieve healthy weight gain in pregnancy. If you have twins, you can add 10 pounds onto the upper limit of all of these. Lucky twins. You suffer in other ways, though. I feel for you. All right, birth preferences. If you're planning to make a birth plan, so first time mamas, this is an experience you've never had before. And sometimes that yields some anxiety, and it may help your anxiety to kind of be able to take control over what you're expecting, like to be able to be an active participant in what happens to you. Labor and delivery should feel like something you are doing, not something that is being done to you. And so writing down some things that are salient to you may help you through that process. So there are a lot of different boxes on here, everything from how you would like labor to start, what you want to wear during labor, how you want to remain hydrated and nourished during labor. I think that's an important point. We do not put you in the bed and strap you down and starve you during labor because it's important work that you need to be energized and able to be an active participant with your baby. Um, Pain relief, we have obviously epidurals because it's a hospital. We have IV pain medicine, but we also have hydrotherapy. There are tubs that are available for labor at the hospital, and we are still working on the nitrous. It is there. There is a policy. We are working on the training right now, and so I'm hoping by the time everyone on this call delivers, the nitrous will be available. But as you can see here, you can labor in different positions, you can push in different positions, you can deliver in different positions. Our standard things are perineal massage, using warm compresses to protect you from tearing, slow delivery of the head. It is unlikely that we do episiotomy. Like I've done this for over 20 years and probably cut 5 episiotomies, and those are for fetal distress. Cutting of the cord, our standard is also delayed cord clamping, immediate skin to skin, and early latching. If you're planning something like stem cell banking, please let us know so that we can balance the delayed cord clamping with collecting enough blood for the baby. Placenta, decide what to do with your placenta. We have on here the list of medications that are routinely offered to newborns. You always have the opportunity to come in and ask the midwives, what is this medication for? Does it apply to me? Should I, is this like, what do I need this? Circumcision, if you're having a little guy and you plan to have him circumcised, we do those in the office before they are 10 days old. We don't do them at the hospital. We like to give them a chance to bond and learn to latch and all those things before we start procedures on them. For my twin moms, there are some choices on here with regard to who you want present, how you want skin to skin to occur. And for my belly birth moms, for those who already know they're having a belly birth, we do the gentle cesareans here at Full Circle, which include limited ambient noise, so basically patient-driven ambient noise, dimmed lighting, skin to skin in the operating room, and clear drapes so that you can see your baby being born and delayed cord clamping. All those good things. So if this looks like a lot of stuff that you're like, oh, no, this is a lot to think about, just remember, everybody on here probably has at least 21 weeks left of pregnancy, and likely every box doesn't apply to you. So just take one box per week. That's your homework, one box per week. And then toward the end of pregnancy, you'll be able to bring it in and talk to the midwives to just kind of sort through what to expect based on which boxes you checked or didn't check. Cervical ripening techniques, because at the end of pregnancy, you will be wondering how to get this baby out. These are things that we put on here. So as early as 20 weeks, you can start raspberry leaf tea. But then you see at 36 weeks is when it really ramps up. So things like evening primrose, chiropractic or acupuncture or acupressure, using your breast pump, that sort of thing, membrane sweeping. So you can just see week by week what things we have on there. And you guys can read. What thing is not on there is castor oil. And if you're wondering why, ask your midwife when you're in for your visit. As we go to the next one, I'm going to just answer this question here. Uh-oh, wait, hold on. Before we do that, I had a question on the board. Are there delayed circumcisions available for religious purposes that can be set up? So in the past, I have had patients for in the Jewish faith who did not have a mohel set up for me to do, or one of the physicians to do a circumcision while they had their rabbi come and do prayers. So definitely, if you have special religious cases, please let us know if I'm answering that question correctly. I'm just making sure you're not asking about delaying beyond the 10 days or anything like that. But if there's anything that's a religious consideration, please definitely bring it up on an individual basis and we can have that discussion. So next question I have out here, do I have any moms who had a previous cesarean who are on the line today? And I do. Fantastic. All right. So first time mamas, I know that does not apply to you, but this does apply to you. So first time moms and trial of labor after cesarean recommendations, because you two essentially have the same goal. People who've had a vaginal delivery before, second baby is always much kinder and easier and nicer to you. And so that's almost a given that you're going to be okay. But first time mamas, you're trying to avoid that first unnecessary C-section. Babies are going to baby. You can't control what the baby's going to do, but control what you can. These are ways to reduce conversion to cesarean. I will tell you the most common reason that we have been doing cesareans here recently, like y'all are killing us with these sunny side up babies, these malpositioned babies. So, all of these things, look at a Webster certified chiropractor, do your pregnancy yoga and Pilates, do your method specific childbirth courses, do your squats. We're going to talk about squats in a moment too. Watch your pregnancy weight gain. Get an experienced doula. This is not a place to cheap out. Don't get your friend who's always wanted to be a doula, and so can she come to your birth and be your doula? Please get somebody who knows how to spin a baby. Speaking of spinning babies, go to spinningbabies.com to find exercises to get your baby in the right position, all of these things. And then trust us that we are also trying to get the same goal. We're not going to recommend things to you that we think are going to push you towards cesarean, because our goal is to avoid unnecessary cesareans just like yours. So doing things to prolong labor, if your water is broken, increases risks of infection, which increases the risk that we have to move to C-section for baby safety. So believe me, if we're recommending anything to move things along, it's only because we're trying to keep you out of the operating room. So please remember that this is out here for all of my VBAC mamas, for all of my first time mamas. Please, please, please help me keep my C-section rate down. As we go back to the webinar, my question is for medications. I'm doing an IV and wanted to know, is Zofran something okay to add to it? If you're talking about at one of those infusion centers, we do have a letter, a standard letter that you can take to infusion centers with a list of approved additives. Just let us know and our OB coordinator can email that to you. Our last box here is the circumcision care. So once again, we do provide those in office up to 10 days. So how it typically happens is you deliver, we ask you, hey, are you planning a circumcision? If you tell us yes, then we say, look out on your portal, because Naisha, our OB coordinator, will be sending you a message to get his insurance information and get him added onto one of the physician schedules. All right. So remember, all of this information is out here at fullcirclejacks.com. So please know you can refer to it at any time and many times during your pregnancy. My favorite patients are the ones who come into labor and delivery with their little printouts and everything's highlighted with stars and stuff. I love those. So we're moving on to nutrition, and immediately I feel attacked because I only had a coffee this morning, Dr. A. Why have I gained all this weight? Did you have a coffee, or did you join me for a salted caramel mocha with 570 calories in it? Did you know that pregnancy only requires an additional 300 calories per day, unless you have twins and it's 450? But it takes 10 calories to maintain 1 pound of body weight, and your recommended weight gain is based on your starting body mass index. So let's say you're starting the pregnancy at 170 pounds. It takes 1,700 net calories to maintain that. If your goal weight gain is 25 pounds, then that's 250 more calories for a total of 1950. So we divide that between breakfast, lunch, and dinner. That's 650 calories per meal. Please do not drink your calories. So if you have 650 calories to eat, do not wash it down with 570 calories of mocha caramel monstrosity, okay? Things that are okay to eat, we're going to go over in just a moment, but we'll look at this slide first, which tells you which nutrients, how to divide things up, and just emphasizing what simple changes can make a big difference. So cutting down on your sodium. You can see just in these two different labels here, you can cut your sodium down, going from traditional spaghetti to herb-infused marinara. You can cut out over 500 milligrams of sodium per serving. And then your fats and your proteins and all of that, you're going to get everything you need. No, you were right. Go ahead. You're going to get everything you need by eating your fruits, your veggies, your whole grain, and your cereal. You're not going to give your babies allergies to nuts or dairy by eating those during pregnancy, so please feel free to enjoy. For my coffee drinkers, you just want to keep your caffeine at less than 200 milligrams per day, which is still quite a bit of caffeine. Just remember that later on in pregnancy, caffeine can also cause some fetal arrhythmias, some irregularities with the heartbeat. So as much as you can cut back on it, please cut back on it. And remember that caffeine is a diuretic, so you want to use your 3-to-1 rule and drink 3 times as much water as caffeine. Herbal teas are fine. Our favorites for pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my vegetarians, for my vegans, you want to have a protein source that gives you 70 grams of protein per day. Some of you will be doing some method classes that tell you to try to take in 120 grams of protein per day. Please don't do that. You are going to grow an 11-pound baby. Just please don't put any of us through that. Please keep your protein around 70 grams daily. And that's a good sweet spot to give you not an underweight, scrawny baby, but a nice, healthy baby. Deli meats, yes, you can. Someone just asked me that today. I know you're on the line. Just make sure that you are microwaving your deli meats for 30 seconds to kill any possible bacteria. It does not have to be piping hot when you eat it, but just know that 30 seconds is enough to get rid of the bacteria. In terms of soft cheeses, as long as it's made with pasteurized milk, it's fine. So if you're buying it from Trader Joe's or Publix, just flip it over. If it says pasteurized milk, you're good. If you're at a restaurant and can't verify that the milk was pasteurized, then you skip it for the day. Canned tuna, you may have up to 3 of the 4-ounce cans per week. If you are pescatarian and you have more questions about fish, the FDA has a really nice document out there about what types of fish you should be eating in large amounts because they have high amounts of omega-3 acids, which are good for baby's brain development, which things to eat in moderation, and which things to avoid or eat sparingly because of methylmercuries. Things you want to avoid are undercooked meats and fish. So if you are a foodie like me and you like your steaks medium or medium rare, you will have to ruin your steaks for the next 6 months. I'm so sorry that's happening to you. And none of that yummy ahi sushi. Everything just needs to be cooked all the way through. For my kombucha drinkers, my kimchi eaters, those are fermented beverage, fermented foods. You want to avoid, if possible, limit greatly. If not possible, alcohol you do want to cut out because we do know there is an associated fetal alcohol syndrome, and we don't know how much alcohol causes it. So we just don't recommend taking in alcohol, which includes alcohol-free wine for some reason because it still has alcohol in it. I don't know why, but just don't drink alcohol-free wine. And your sodium you want to limit to 1,500 milligrams per day. If you start looking at nutrition facts on the foods that you eat, you'll be appalled at how much sodium is in it and knowing that you have to limit yourself to 1,500 milligrams for the whole day. And the question I have is store kombucha okay? And the answer is still no, because it's still considered a fermented food. And so what you're trying to avoid is anything that goes through process of fermentation, similar to making alcohol. And that's the rationale behind that. All right, any other questions on food before I move to exercise? Oh, another question on food. All right, you guys are foodies. Do I have to fully cook red meats? A well done steak, for example. Yes, as I mentioned, you will need to ruin your steaks and make them well done the entire time. Sorry. Don't worry. That was like the first thing no, actually, what I wanted was sushi and a mojito after I had my first baby. All right, we're going to move on to next. No runny eggs either, right? Nope. Go ahead and cook those eggs all the way through, please. We're avoiding salmonella in all rounds. Because honestly, things that won't get anybody else in the house sick will get you sick because you're immunocompromised right now. So you're more susceptible to any even trace amounts of bacteria in your foods. These are all really good questions. All right, moving on to exercise. It is okay to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. But you just won't feel like doing very much in your first trimester. So second trimester has physiologic changes where you increase your blood volume, your oxygen tension and saturation, and that will accommodate more aerobic activity. So just listen to your body to get back to the level of physical prowess where you were prior to pregnancy. It is also okay to begin a new regimen. Doesn't have to be anything crazy, but just doing something to get your heart rate up every day. I know some of you are saying, oh, yeah, I walk a lot and walking is my exercise. Now, if you are walking and your heart rate is in the aerobic zone, then yes, then walking is your exercise. But if your heart rate is still right around where it normally is when you're walking, then that's not actually exercise. I don't know if you guys can see the next slide, but sedentary lifestyles lead to malpositioned babies, as I said before. So those of you who are working from home, please invest in one of those, the sitting balls, the birth balls that you can sit on to correct your posture from keeping you from slumping. Because as you slump, your baby settles into your pelvis sunny side up, and it makes everybody's life miserable when it's time for you to go into labor. Those of you with these cute little Fitbit watches, your resting heart rate you will notice is 10 to 20 beats per minute higher than it usually is. That is okay. That is normal. That is physiologic. As long as you are not getting dizzy, lightheaded, or passing out with your elevated heart rates, that is just fine. Great. The aerobic zone, as I was mentioning before, is 70% of your maximum heart rate, which is based on your age. So 220 as the starting number. Let's say you're 30 years old. You start with 220, you subtract 30, your max heart rate is 190. So you should not be exercising with your heart rate sustained above 190 for extended periods of time if you're 30 years old. The aerobic zone being 70% of that is about 133. So again, if you are walking and your heart rate is between 133 and 190 sustained for 30 minutes 3 times a week, then you are exercising. If your heart rate is still 80 to 100 as you're walking around, then you are just walking. It's transportation. Transportation is good, but it's not exercise. This is exercise. Cardio. If you love the treadmill, do it. Elliptical, go for it. Running, yes. Swimming, my favorite. You guys are pregnant during the summer and you're so lucky. So get in that pool. It makes your belly weightless, makes your joints so much easier to move. Indoor bike is fine. If you have a Peloton, my leaderboard name is Off My Meds 8. Follow, I do follow back, and we can exercise together. Put some blue dots on the board. Weightlifting, you can lift whatever you are lifting up to your pre-pregnancy amount of weight. You do not need to increase your resistance during pregnancy because your baby and your body are doing that. Squats are my favorite to open up the pelvis. So please, if you're already an experienced squatter, please continue. If you have not started squatting yet, at 20 weeks, you're going to give me 5 squats a day. 21 weeks, you're going to give me 10 squats a day. 22 weeks, 15. We're building up to 50 squats a day. You can do them all throughout the day. They don't have to all be at one time, but those things help to open the pelvis and make those muscles long and lean. Pregnancy yoga and pregnancy Pilates are also things to open up the pelvis and make everything long and lean and stretched out. And your instructors, any experienced instructor will know what the pregnancy modifications are for those. Exercises that we want to stay away from during pregnancy, high intensity interval exercises after your first trimester. It's not the interval, it's the intensity. So you can still do the low impact versions of those things, but we don't want to do things with sudden jerking movements that could shear the placenta off the side of the uterus. Exercises that have you lying flat on your back, like excessive ab work. You can do side lying abs, you can do standing abs, but just not anything on your back, like crunches off of your back. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment, because you will get dizzy and you may fall. We don't want you to fall on your belly. We also want you to avoid scuba because of changes in barometric pressure and decreased oxygen to the baby. High altitude hiking. If you are visiting your family in Colorado, you are cool up to levels 8 to 10,000 above sea level. Just don't go hiking with them during that time. Contact sports, please no kickboxing, none of that. And outdoor biking after 16 weeks is not necessarily a no. It's just be careful. 16 weeks is where your center of gravity changes, and instead of trying to turn those curves, you may end up falling over a bit more if you're not able to compensate for that. So just keep that in mind if you're biking outdoors. So our next poll question says that now we've discussed nutrition and we've discussed exercise. So if you do everything right, can you prevent gestational diabetes with diet and exercise? And the answers are pouring in. And my veteran mamas know me very well, and so they know. It's not a trick question, it's a true question. Polls are closing in 3, 2, 1. And the answer is no, because the key word here is prevent. Can you prevent gestational diabetes with diet and exercise? Remember, I told you I was going to talk about gestational diabetes. Here it is. The reason why we screen everybody for gestational diabetes is because of your hormones. You know how hormones control everything? Your number one risk factor for gestational diabetes is your placenta. Your placenta gives off hormones that decrease your efficacy for insulin working. Insulin has one job. Insulin is supposed to clear your body of excess glucose so you can use it for energy. The hormones from the placenta, some people are more sensitive to them, and it makes your insulin not do its job, which leaves excess circulating glucose in your bloodstream, which is the definition of diabetes, but it's gestational diabetes because it's caused by hormones in the placenta. So it is not a judgment on your family history, on your lifestyle, on how much sugar you eat, on your weight, nothing at all. It is just how your body reacts to hormones from the placenta. So for my moms who say, well, I don't ever eat any sugar at all, don't avoid carbohydrates prior to the test because you do take in good carbs. So fruits, whole grains, don't avoid those because then your body will get used to not processing them. I'm going to come back to the question that's out there right now. If it is the drink that gives you pause with regard to glucose screening, we do have some alternatives. So the Simply Pure drink we have available for sale at the office. It is soy-free, it is dye-free, it is gluten-free, BDO-free, kosher, vegan. It is offensive to almost no one. And we do have that here. There are other patient-driven options on the website. So remember that box that I said, we're not going to click on it, but I'm going to refer back to it. This is me referring back to it right now. So those options are Glucorganics, the Fresh Test, and glucose tablets. And there are links on the website to each of those. If you plan to do one of those tests, please let us know because Quest does not accept outside forms of glucose. And we need to write on your lab slip that you're going to be bringing in your own from home. Do not open it before you go there and don't drink it in front of them or don't eat the tablets before. All that stuff is on that page, but all the instructions for what not to eat. We've had a lot of people who are eating the wrong things before the test and then saying, oh, I think that's why I failed it. We don't redo 1 hour glucose. So please do the 1 hour glucose right the first time so that we avoid having to do the miserable 3 hour test. So remember, all that stuff is out there on our website. The question that I have now is, can I continue breastfeeding while pregnant? As long as you don't have any risk for preterm delivery, like you're not having contractions or bleeding, it's fine to continue. Birth classes, childbirth education classes, again, these are just some listed for educational purposes or informational purposes. So these encompass hypnobirthing, hypnobabies. I think Lamaze and the Bradley method are on here as well. So just know that all of these things are available and the midwives can tell you more about that. What things can we do if our blood work says we have anemia? Is iron supplement the only option? No, actually, there are lots of foods that are available that are high in iron, and the midwives have, I believe they have a printout of foods that are rich in iron. So when you come to your next visit, you can ask them for that, and they can tell you how to increase iron in your diet. Breastfeeding classes. Oh, and it also does depend on how low your iron is. Like if you're in a point where you're severely anemic, then your diet is probably not going to bring it up in enough time to keep you safe at delivery. Going into your delivery with a low hemoglobin is a risk factor for needing blood transfusion because everybody bleeds at delivery. But we just want to make sure that you don't start out extremely low so that you bleed down to a point where you need a transfusion. So our goal at getting your iron and your hemoglobin up before delivery is to avoid transfusions. Breastfeeding classes, we can connect you with La Leche League, and there is actually also going to be a group that is offering breastfeeding classes at our office. They're holding them at our office. They're not affiliated with us, but very convenient. Every new parent should know CPR. Here's a link to get a class from the Red Cross. Chiropractic, if you're already seeing a chiropractor, please make sure he or she is Webster certified. And that is a special certification for the differences in your body during pregnancy so that they'll know how to adjust you appropriately without harming you or your baby. So my next poll question is about doulas. How many of you are planning to work with a doula? And as you answer that question, I am answering Midwife Lauren. Okay. All right, polls are closed. Boom. Oh, awesome. Lots of you are planning to work with doulas, and then some of you are not sure. Well, I'm glad you asked. Let me tell you what doulas are for. So doulas are there for physical and emotional support. before, during, and after pregnancy, sorry, which includes breathing techniques during labor, helping you get into positions to make the contractions less uncomfortable, help you rotate the baby so that he, she, or they come on out, and relaxation strategies because you are very tense during labor. You're going to sabotage your body from doing what it wants to do naturally. Doulas are not there to give medical advice. So, doulas are there to help you emotionally process the medical advice that you're getting from your medical team. So they are not advising you on medications to take or things like that. They're helping you to kind of work through your feelings about the recommendations and the diagnosis that you may receive during pregnancy with us. And that is why people say, well, why do I need all these different people? So they're not prescribing medications. They're not going to deliver your baby. That's literally what you're paying us to do. And they're not providing medical care, but they are part of your medical team because we're a holistic practice and we believe that your emotional and your mental state are part of your well-being for a healthy and successful delivery. Next. Also for postpartum care, so ask your midwives about recommendations for doulas, antepartum and postpartum doulas. So they're good for all throughout this entire safari. We do recommend acupuncture during pregnancy for various times. It helps with nausea in the beginning of pregnancy, and it helps with pain, and it can help with labor induction, natural induction. Pregnancy massage is also okay. Most places won't do it in your first trimester, but just let us know. We have a pregnancy massage letter that we can give you in second trimester, so that you can get them done. They are very relaxing and soothing. All right. Breast pumps. Most of your insurances will cover breast pumps. Please scan our QR code in the office to go through a company that contracts with your insurance. They will call your insurance, find out what pumps you need, write the prescription, send it to us, and then we will send it off. Please don't go trying to find your own company to get the breast pump because it is invariably a difficult process with a lot of different. We tried many different companies, is the short story, and ultimately came out with this one that makes it very easy for everybody. Around 20 weeks is a good time to do this. You'll have your breast pump many months before your baby arrives if you do it then. Great. Um, if you are requiring FMLA for maternity, and this is for maternity or paternity leave, we're moving away from doing it in the office. We are using a third party vendor. Most forms are completed in less than 24 hours. Any of you who've had FMLA forms completed with us before know it used to be 14 business days. And so please contact the office when you're ready to get your FMLA paperwork filled out for more details. So we'll give you information on how to get that done through a much more efficient third party vendor. And you control that. We just kind of refer you to them, and they get it done. After the baby is out, anyone who's had any issues with blood pressure will be seeing you in the office in about a week afterward. Those who've had belly births, you get a 2-week incision check. Everyone does routine mental health screening after delivery. Baby blues are common. About 80% of women will have those in the first 2 weeks. If it persists beyond 2 weeks, though, we start looking at postpartum anxiety, postpartum depression as possibilities. Postpartum doulas, I mentioned before, if they're there for physical and emotional support, when do you need that more than when you just had a baby? The Motherhood Space is a new grant-supported program in Jacksonville. We're one of 5 cities in the nation that received the grant for it, located at the Winston YMCA. And if you are a candidate for that due to what you score on your mental health screen, we'll refer you for that amazing resource. And then pelvic floor therapy, which is standard in many countries. We routinely start that at 8 weeks after delivery to help with feelings of heaviness after delivery in your pelvis, urinary incontinence, or healing with laceration repairs. All right. Random frequently asked questions. We're almost there, y'all, I promise. You can sleep on your left side, your right side, on your back. It is not dangerous to sleep on your back. We don't like you to labor on your back, but sleeping like there is fine. If it freaks you out, like you wake up, dizzy, you can get one of those wedge pillows off of Amazon to put under one of your hips so you don't roll completely onto your back. You can help paint the nursery as long as you are in a ventilated room with a mask. You can take probiotics when you are pregnant. You can dye your hair, including your eyebrows. You can do gel nails. If you're going to be in a salon with heavy fumes, you may want to consider wearing a mask so you don't get dizzy and pass out. Car travel is fine up to 37 weeks. Beyond that, I mean, car travel is fine, but like if you're going to be far away, then you don't want to accidentally deliver with somebody who's not us. But just make sure you're drinking your water so you're getting out and stretching your legs every 2 hours. Skincare, you can use your salicylic acid, your benzoyl peroxide, just nothing that has retinol in it. If you need a retinol alternative, Bakuchiol, Bakuchiol, is one that has all of the good properties of vitamin A without the harmful retinol properties. Flying is okay for up to 32 weeks for my twin mamas, 36 weeks for my singleton moms. Just be sure that you are wearing your compression hose, you are staying hydrated, getting up and walking around, and doing your toe raises in your seat so that you can keep your circulation good and prevent blood clots in your legs that may travel to your lungs. If you need to fly beyond the times that we recommend there, airlines will typically require a letter from us saying that it's okay. Like if there's some family emergency, we understand that sort of thing. Things you want to stay away from: roller coasters and water slides. Don't go chasing waterfalls. All right, COVID-19 update, and then we're done. Vaccinations. ACOG moved from supporting either way to strongly recommending it after the New England Journal of Medicine study of 35,000 pregnant women in April 2021. Moderna and Pfizer as manufacturers are fine. We don't recommend Johnson & Johnson because of its independent risk of blood clots, along with pregnancy's risk of blood clots being synergistic. All vaccines are approved for boosters. If you plan to get a booster for your COVID vaccine, third trimester when you're getting your other ones is very reasonable because then you will have antibodies which you can pass to baby during breastfeeding. So if you're 6 months past your second Moderna or Pfizer, you can get another one. If you're 2 months past your Johnson & Johnson, you can get a booster, but not of Johnson & Johnson. Mixing and matching is okay. And there's no optimal time for these versus your flu vaccines, your RSV, or your Tdap, which again, RSV isn't available at the time anyway because of the season. It comes back in the winter, I believe. It's seasonal like flu. If you do contract COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we do not prescribe those. What we do recommend, though, is vitamin C, vitamin D, zinc in the doses that you see here. We also recommend starting a baby aspirin, 81 milligrams daily until you're 36 weeks. At the time of your diagnosis, after your anatomy ultrasound, we'll start serial growth ultrasounds to make sure that baby is not affected by COVID. We have seen growth restriction due to pregnancy-induced hypertension following COVID infections during pregnancy. If you contract COVID after 36 weeks, do not start the baby aspirin. If you do get COVID, we do recommend supportive therapy at home. Remember, the cold medications are on our website: cough, cold, sore throat, congestion, all that stuff. You only need to go to the hospital if you're having difficulty breathing or your fever is greater than 101 and you can't bring it down with the appropriate amount of Tylenol. We're back to 4 visitors plus your DONA certified doula in the hospital. So those of you who have babies in 2020 and 2021, take a deep breath. It's not like that anymore, okay? We're not requiring masks in the room or in labor unless you are actively positive for COVID during that time. We don't separate moms from babies, even if you are COVID positive. You're given an isolette to keep baby in so they're not exposed to your respiratory droplets, and you get an N95 mask. So our last question of the day, you made it. What things can you find on the website? Can you find the birth plan template, safe medications in pregnancy, what to expect at your visits, or are you an excellent star test taker and read to the end and know that the last answer is the correct one? Strong work, team. All right, you have completed it. Good job. Please follow us on all the things because we are, in fact, social. We are on the Book of Faces. We are on the Gram of Instas. We are on X, formerly known as Twitter, and we are on the Tube of Views. This presentation will also be on our YouTube channel, so you can see it there. And just know that we do sometimes share our rockstar birth stories. So if you have an amazing story, please feel free to share it. Give your midwife a 5-star rating on Google, Yelp, and all the other places. because we are very fortunate to have you join us. We know that you can throw a rock and hit an obstetrician. Don't throw rocks at us, please. But we know that there are a lot of people to choose from, and we're happy that you chose Full Circle to grow your family. So thank you for your attention today. I appreciate you guys more than you know. And again, this is available on our YouTube channel. We'll see you guys in the office real soon. Bye. Bye.